Well, we're back. This is Jimmy Phillips with Kettering Health Network, and we're here in our Network Operations Command Center, otherwise affectionately known as the NOCC. This opened in January 2019. Tell us about the NOCC and just what it is.
Really, it is just a group of a lot of individuals in one room that really can share information quickly so we can move patients throughout the continuum. So between hospitals, out of the OR, out of ICUs, coming from the ER and going upstairs. But really it's just a group of leaders and a group of clinicians that have come together so we can share that information and kind of move patients throughout our health system, coming into it, going out of it, and really try to take that relief out of the hospitals so the folks there can actually be at the bedside interacting with patients.
It almost has a feel of like a NASA type facility. Was there an inspiration around designing this?
This is all called situational awareness. So it actually comes out of WritePad. So the science, the evidence, and all of it was actually developed at WritePad, but it's used nationally. It's used at NASA, it's used for oil industries, it's used for nuclear power plants, and really for us it's very similar to what you think of a 911 center.
All the patient care at our facilities, specifically for our ORs, our emergency rooms, you have a team here that's able to see where those folks are at all times and essentially manage the operations of care from one centralized facility.
We have 13 emergency departments. We have 150 outpatient clinics, so whether it's on-demand, urgent care. So they can call here. We need to admit someone. The team can quickly look and see where is their capacity. So where's the right bed? Where's the right room? Where do we have enough room in one of our hospitals? Clinicians already there and ready. And then we can redirect that to any of our sites. So when you think today, when we're doing with designated units and COVID-19, one of the governor's mandates was trying to co-locate those patients so we could preserve PPE. So that's critical because we right now have Grandview, Kettering, Sycamore, Soin, and Fort have our designated units today. So that means Green, Huber ER, Southview, Preble, Middletown, anyone out of the network trying to come in, on-demand clinics, we can call here, and that team actually looks at that skittle board to say, okay, where's the right place to get this person? Where do they live close to home? Where do we have capacity? How do we get them moved there? And on the other side of this wall is the other parts of the logistic command center that's going on. So we can share that information with them to say, okay, you might need more PPE at this hospital because we've added more patients there that have COVID or are being ruled out for COVID.
This is the only facility like it in the Dayton area, right? Why is this such an advantage for us?
Yeah, so for us, as we see that spike of patients come up, the team behind you is our central staffing now, so they're piloting. So we know where every employee is real time in the network. So we can know, do we need to realign staff, realign resources? They know every open bed in our entire network. Plus they know what's going to Ohio State, what's going to Cleveland Clinic, what's coming in. So again, to rebalance. The team over there is our transport team, so they can say, oh, we have a helicopter coming in, we need to move a MICU, I've got these persons getting discharged, these are all going back to a nursing home. So we can see real time throughout our whole health system about 1,200 beds.
In many ways, this is business as normal for the team that's in here in the NOCC, and there's a whole lot of operations happening behind the scene from this central location that will allow us to be ready no matter the number of patients that are coming into our facilities. Ultimately, it's a great thing for our community as we continue to navigate this COVID-19 crisis.